Okay, I'll start sharing to our Facebook.
Alfreda, you can start. 6:02.
Good evening. We've heard your questions, concerns, and the misinformation being circulated about the vaccines. In an effort to bring you answers, we've collaborated with Michigan Medicine's Community Health Services and our NIH-funded project, Michigan CEAL, and our additional co-sponsors for tonight, the Faith-Based Genetic Research Institute and Faith Community Research Network, coordinated by the Faith-Based Genetic Research Institute, Wayne State University, and Carmana's Cancer Institute to bring you valid information, but most importantly, to hear your concerns, fears, and answer your questions. We see you. Thank you for joining us for the 5th installment of Michigan Communities Conquering COVID. My name is Alfreda Rooks. I'm the director of Michigan Medicine's Community Health Services, and I have the privilege of being your moderator for the evening. As a reminder, Spanish interpretation and closed captioning are available through Zoom. This evening's town hall features Imam Ibrahim Kazerooni of the Islamic Center of America in Dearborn. Imam Kazerooni is the English-speaking imam for the Islamic Center of America. He earned his PhD from the University of Denver and Iliff School of Theology. He is a fellow at the Center for the Study of Human Trafficking. Currently, he is adjunct faculty at the University of Detroit Mercy. We are also joined by Bishop Bernadel Jefferson of Faith Deliverance Center in Flint, Michigan. Bishop Bernadel Jefferson is pastor, a community activist, commissioner, and community researcher, is a graduate of Agape Bible College with a bachelor's degree in theology. She has acted as head pastor of Faith Deliverance Center since 1991, where she assumes responsibility for assisting in the management of the day-to-day activities, including strategic planning, project and program management, products and services development, grant writing, fund development, marriage counseling, and professional development. Since 2014, Bishop Jefferson has been a tireless activist in fighting for the rights of citizens to improve water quality and change laws that will enhance the lives of Flint residents. Our third faith-based speaker is Bertram L. Marks of the Faith-Based Genetic Research Institute in Detroit, Michigan. Dr. Marks has a practice that includes, he has been a practicing trial lawyer for 26 years. I don't want to leave that out, a practicing trial lawyer for 26 years. His practice includes products liability, medical malpractice, ecclesiastical and corporate law, civil rights, personal injury, and white-collar criminal defense. He holds an undergraduate degree in political science from Wayne State University and a law degree from the University of Detroit. Dr. Marks earned master and doctoral degrees in ministry from the Ecumenical Theological Seminary in Detroit. He is the chief legal counsel of the Faith-Based Genetics Research Institute. And our medical expert for the evening is Dr. Sandro Cinti. Dr. Cinti is a professor of infectious diseases in the Department of Internal Medicine at the University of Michigan and the Ann Arbor VA Medical Center. Welcome to you all.
Alfreda, can we need to turn the interpretation off really quick and switch to Angelica as the interpreter. So can you pause a second? Amy Rooker is going to switch the interpreter because our interpreter has joined us. So we're going to take Maria off. We're going to add Angelica.
May I suggest that Maria logs off completely so that we don't run into technical difficulties?
Okay. So Amy, add Angelica. And then Angelica, if you could tell us in both English and Spanish to switch to the right channel.
Sure thing. As Tricia mentioned, if I can have all the panelists, please join to the English channel. And all my Spanish speakers, I will go ahead and ask them to switch to the Spanish channel. Hola, ¿qué tal? Buenas tardes. Si los que me escuchan pueden cambiar al canal de español, por favor, para escuchar la interpretación. Muy amables.
Angelica, is your display name Paz?
Yes.
Okay, thank you. You should be all set.
Thank you so much. You know, when we use technology, we should always expect that there will be something that we will need to do. It's just the way of the world. And I think that's one of the things the pandemic has taught us to be, and that's flexible. And so I thank you for making that switch so that we would be sure to make sure that our Spanish speaking participants are accommodated and available and can hear and be represented during this talk. So thank you. So I've introduced our panel members. And before I get started with the questions that came from some of our questions from earlier, either through previous sessions or things that were presented this evening, I wonder if I could just take a few moments and give each of the panelists an opportunity to have a brief opening comment or statement. And so I'd like to start with Imam Kazerooni. If you have anything you'd like to say to start us off, would you please do so now?
Well, I can't say much beyond saying that this has been a difficult time for all of us. And it's a time where we had to adjust ourselves, adapt new policies, adopt new way of life, and gradually come up with some kind of a strategy that we will address the crisis. I think this is a brief outline, and then as the question comes in, I will be able to talk about it or explain further.
Thank you. Bishop Jefferson, would you like to have opening remarks?
Yes, I would. During this time of the COVID, it is very new to the entire world. And being a mother, being a pastor, being a community activist, it meant that I had to do my homework even the more so that those that trusted me to make to give them information, not make a decision, give them information. And there were times that I had doubt. So it was a complex time for all of us, but through prayer and through seeking, through science, we have come this far. So I'm grateful.
Thank you. Thank you. And Dr. Marks, if we could have opening remarks from you. You're still on mute.
Sorry about that. Sorry about that. We all know this was a challenging time, but in this time of challenge, there's also opportunity. And the opportunity for especially communities of color is to engage more with medical science, to engage more with strategies that produce better health outcomes. I think that this COVID period has shown us that underlying conditions exist in our community that are easily curable if we make lifestyle changes, if we make dietary changes, if we exercise more. So I really view this as a time for opportunity for us to really dig into the science and really begin to develop that relationship with science that other communities have, and it keeps them healthy and it keeps them aware of the growing technologies and the advancements of medical science. And these advancements are saving lives and curing diseases. So I'm excited about the opportunity and looking forward to making that connection even stronger.
So Dr. Marks, that was a very great segue to my first question, which is, how do you align your faith with science?
Well, I think it's easy for me. You know, I believe that this universe was created by a higher power. And I believe that when we talk about the Big Bang, you know, something had to produce the Big Bang. There's some scientists who say it just happened. Well, I don't believe it happened randomly. I don't think science and faith are at odds. I think they are interconnected. And I certainly believe that the advances that we are experiencing in medical science and science in general is a direct result of divine intervention. So I don't see them as separate. I see them as partners. I actually have a book that I'm reading. I can't recall the author's name, but it's Physics and Faith. And it's fascinating. I think it explains some of the phenomenons that we see occurring in our daily universe, ones that we can attribute to a higher power, but the way it's manifested is through a very scientific process that can be explained.
Okay, thank you.
You're welcome.
Bishop Jefferson, if you would answer the same question, please. How do you align your faith with science?
In Proverbs, it said, in all thy ways acknowledge God, and he will direct our path. And so in March, we had a 24-hour prayer all over the United States. I had people praying for 1 hour. And if you pray, then whatever the answer you get, you ought to be ready to respond to it. And the first thing on the top of the list was deliverance from COVID.
Mm-hmm.
And I had so many doubts because there was so many different opinions and so much different research. I mean, one day you needed 2 shots, next day you only needed 1. And then before the shots were out completely, they could see signs of improvement. So I had a lot of doubts and a lot of misunderstandings. But after the 3rd, and I heard the Lord say that I would have an answer. And one of my colleagues told one of the news channels to do an interview. And I said, oh my God, I don't want to do this interview with, and I don't want to give a negative report.
Mm.
And so she called and I said, well, I'll have to get back with you in an hour. But in the meantime, the colleague that asked me to do it, she called and she was able to answer all of my questions to alleviate all my doubts through science, through information, through knowledge, and through the education that was out there. So with my faith and my trust that God had led me to that person in order to give me an understanding, I was able to share with somebody.
Great, thank you. I think sharing by
So
word of mouth is one of the important things that we do.
faith without works.
Yes.
Yes.
Thank you.
Yes.
Imam, if I could ask you how you align your faith with science?
Well, I have heard so many during my university days debate between religion and science, faith and science, that the 2 words are used extremely liberally without clear definition. So I'm grown a little bit wary, and I would like to start with some kind of a working definition of what is science and what is faith. If we define faith in a narrow box that we open it either on Sunday morning and then or Saturday morning or Friday morning, nothing to do with the mystery that contains within the universe, then I don't believe such a faith has anything to do with science. And even if the science is defined in a particular manner, but within our faith, we look at the cosmos, of the universe, to be the open book of divine mystery. Every single one of us, the faith leaders, the scientists, the philosophers or mystics and so on, they are searching to shed light into that divine mystery, but from their own angle. But we collaborate with each other and we understand, we work together to understand that mystery. So I don't see any kind of conflict in stating that there is between my faith and science, there seems to be some kind of oddity. No, I would like to echo Dr. Mark's comment right from the beginning. When we start with the clear belief that the world has, there is an intelligent design behind it, then science, faith, theology, and everything else are part of that attempt or a struggle to refine that mystery.
You're muted, Alfreda.
I'm sorry, excuse me. I said something really profound and you all missed it. So my question to you, Bishop Jefferson, was what are the current communication issues and challenges around COVID-19 your communities are facing?
I'm so glad you asked that, because after I read the question, I got on the phone and started calling, because I really wanted to know. And I had heard it before, but I wanted to know. And one of them, she said she had COVID already. So she don't, and it's not enough research. Then people are guinea pigs. How long do they last? Does the shot last? Do we have to have a booster after it? That was a female's perspective. Another perspective from the community was not enough research, and it would stop her from stop her reproductive system, that she wouldn't be able to have children. A male's perspective, which is in the medical field, and his was the science. Only was if it was a mandate from his job. And like I say, he is in the medical field, he's a traveling nurse. So another one that took the shot, and he said that if he got COVID, it would lessen the effect on him from the COVID. And so he would rather have the shot. And like him and like myself, I've seen so much death from COVID. I've seen so many people struggling with this disease. I mean, sick for months, not just 2 weeks or 10 days, but for months they are sick and still have effects from COVID. So the one young man that was in the medical field, he got the shot in February. So it's mixed emotions.
Yeah, I think that has been part of what we've seen is a lot of mixed emotions, a lot of people who are on the fence. And so, Imam, I'm wondering, what have you heard from your community?
Well, interesting to hear that we seem to be getting similar kind of ideas being publicized within different communities. As we were, I define the phase that I went through, at least in my case. The initial phase was a phase of paralysis, that we really didn't know what was going on. There was no clear policy, there was no information. By the time we moved through that and we got into the second phase of protecting and so on, the third phase, just before the vaccines became available, we had an unbelievable conspiracy theory ideas being presented within the community. Various ideas. Number one, there is a computer chip in this vaccine that once you are injected, they can control your whereabouts. You become part of some kind of controlled by these unknown factors or unknown individuals. Not enough research has been done. So as the bishop indicated, that we are becoming the guinea pigs for this process. We don't know what's going to happen. A lot of reproductive issue, that whether these vaccines are going to have some kind of effect on the reproduction, particularly male impotency and other things. In our community in particular, there was an extensive exchange of ideas or through social media that the ingredient contains some kind of unlawful, material in it, which are not allowed. And there were a number of others. Why should we do it if we have to go through this again in 6 months or a year later? etc., etc. So the conspiracy theory worked really hard at the beginning to destabilize the community, and it put huge amount of responsibility or our shoulder, particularly this center being this not the biggest center, on my shoulder, to counter these ideas, to research extensively and find out exactly what were the ingredients, etc. I had conversation with a number of physicians. I went online, downloaded huge amount of information, communicated with the scholars, and finally we came up with a rebuttal, a clear step. I dedicated one Friday sermon to literally going after this conspiracy theory issue and proving them that all to be wrong because of facts and figures. So still there are some exchange of emails, Facebook, and so on, that it is not necessary, or there is some kind of hideous hand behind it to control, etc., etc. But I think we have overcome that period, and to make it easier for the community to understand, we worked with hospitals around, and we turned the Islamic Center into a vaccine center, where at least at the beginning, one day, which was Friday, and then now we are doing it to 2 days, where people can register, register, and come and get vaccinated for free of charge. This helped to alleviate the situation a little bit better.
Great, thank you. Dr. Marks, have you seen similar with your communities?
Yes, indeed. I think that the biggest battle that we have is the battle of information. There are so many anecdotal stories about what has happened to this individual and that individual, and that's really dangerous, because we're not relying on the collective science, because there's so much distrust. You know, I think everything is political, but I don't want to make this political, but we have to acknowledge that the previous White House did not have the confidence of a lot of segments of the community. And that lack of confidence and connectivity created a tremendous amount of mistrust and doubt. And that was the chief concern that has been expressed over and over again. Mistrust, doubt, even some of the issues that Imam Kazerooni brought up about impotency, and you know, Bishop Jefferson talked about reproductive health and how it might be impacted. And it just required us to rely on the professionals, those, you know, like Dr. Cinti, who is, you know, part of the internal or the Vaccine and Therapeutics Task Force. You know, these are people that are, you know, we're consciously trying to absorb the impact of misinformation and put out something comprehensive that the CDC was in agreement with, that the state health departments were in agreement with, that the city health departments were in agreement with. That's a monumental task. And any time there was a gap in information, it only fed these deepening conspiracy theories. And that still is the case now. And so that's the biggest battle, fighting information, distinguishing what is anecdotal, distinguishing what is just flat out false with the trials, the studies, the true science that's gone behind this.
Yes, yes. And that is, again, another great segue. Dr. Cinti, we've heard a lot of talk about the side effects, concerns about fertility, concerns about impotence. I'm wondering if you can talk about what you've heard, but also how do we track side effects from the vaccines? Who does it? How does it happen? What are we seeing?
Yeah, thanks, Alfreda, and thank you all. I think it's great. I think part of what we have to do is translate from the science into the communities. And I was so happy to hear from Imam Kazerooni that you have a clinic, that you set up a place that for people to get vaccinated, and they probably feel much more comfortable coming there to get vaccinated than even coming to the stadium or all the other places where we're vaccinating. So I think those efforts have to continue. there's been a lot of, as you all have said, conspiracy theories about the vaccine. Part of it is because the vaccine came quickly. It's a new vaccine. I'm talking particularly about Moderna and Pfizer. And these turn out to be, though, excellent vaccines and very few side effects. There's no chip. I think everybody's pretty aware of that. There's the fertility issues. There are also no fertility issues. And if you look at the major societies, the obese societies in this country, they have all supported women who are pregnant getting the vaccine because they are at such high risk of complications if they get COVID. So we are really trying to continue to promote that message. And you are exactly right, Dr. Marks, that anecdotal things get in the newspaper before anything else. And so we really have to push the studies. And because one example is people are saying, oh, there are people who are vaccinated who still get COVID. And that's the truth. But that's not most of the people that get vaccinated. It's a small number of people who get vaccinated can end up getting infected again. But we have to say, I have to get out there and say, if 95% of people who get vaccinated aren't getting it, then there's a small percentage that end up getting it. So and the information changes. This SARS coronavirus is still very new. It's just a bit over a year old. And I know from finding when we have found new infections in the community and in the world, it takes a long time to get that education out, and things will change. We could see variants. The CDC just came out and said masks off in many situations, and I think that confused a lot of people. I think there'll be questions about that. So I've been answering a lot of those questions. But I think it continues. I'm happy to answer those as they come up. But around the issue of the safety of the vaccine, the vaccines we have in this country, they're the Moderna and Pfizer, which have been most of the vaccines, are extreme, and then the J&J are extremely safe. And if you look now, we've vaccinated 200 million people at least in this country, and it still has been safe. Alfreda, you say, how do we find those? That's a great question. What people do is the most severe side effects are called into the CDC. There's the vaccine adverse events registry where people can call when they get vaccinated. They get a little card where somebody themselves can put in their symptoms into that system. And so that system is collecting almost anything that is put into it. And then the CDC will look back and periodically go through that data and figure out what's real, what's probably not associated with vaccine, and then put those out in publications. I really think the CDC is a great place, and the information that you get from the CDC is where we should all be looking. And, we talked about two different administrations. One thing that's very clear is the CDC in both those administrations has been solid, and so has people like Anthony Fauci. They've always spoken the truth. They're not always sure. And anybody who's too sure about what they're saying needs to rethink that. But they're trying to do their best. So I'll stop there and answer other questions too.
Well,
thanks.
Actually, that was a really great information that you provided. And the vaccine adverse effect registry is also available online. So you can do it either way, and it's very easy to use. Full disclosure, I had to use it because I had an adverse reaction when I got my COVID vaccine, and it was really easy to do. So I encourage folks, if you're having anything, to just put it out there so they will know.
Well done, Alfreda. Thank you.
But since you brought this up, I'm wondering if you can clarify the masking requirements by age and inside versus outside.
Yeah, so what's become very clear, and the CDC, I think one of the problems is they weren't very clear on this part of it when they said masks off. The people who are vaccinated, we now know there's millions and tens of millions of people who have been vaccinated, and there are studies coming out of Israel, the UK, the United States, and other European countries that show that the vaccine is safe and that the vaccine is effective at both preventing somebody from getting disease and preventing them from spreading disease. And when the CDC knows that, then somebody who's been vaccinated can be with their masks off in most situations, and they're still going to be safe. And people might say, well, what about people who aren't vaccinated? They're not going to be safe in those situations. And so that's why we have to continue to try and get the population to get vaccinated. And many of you have seen Anthony Fauci out there who says we need to get 70% of our population vaccinated in order to have what we call herd immunity. And that's basically, if once we have that many people vaccinated, it protects everybody else in the community. I think one of the problems is we may not get there very quickly. And so the CDC was taking all this data saying vaccine is safe, vaccine's very effective, people who have been vaccinated are safe and they're not going to spread the disease. So that's where those recommendations come from. And so not having to wear a mask outside and even inside, it's still very safe to do that when you've been vaccinated and fully vaccinated. So I mean, you've gotten your 2 shots of Moderna or Pfizer and have been 2 weeks out, or you've gotten your J&J shot and are 2 weeks out. So again, it came quickly from the CDC and people were taken aback because just a few weeks ago, everybody was saying, wear your masks. And now they're saying, go ahead and take them off. But it's based on data. It's not based on politics. It's not based on anything else.
Okay, so thank you very much for providing that information. I
Sure.
want to switch now to one of the questions that came in from the chat from someone who's watching. And the question is for our faith leaders. How will you handle the new CDC guidelines in your community, your church, and in your personal lives? And so Imam Kazerooni, if I could ask you to weigh in on that question first, please.
Yes, I'm more than happy to do that. But I think for the benefit of everyone, can you outline exactly what CDC guideline is?
I can summarize. I can summarize those. Yeah, the CDC is saying for definitely in outdoor settings that the people don't have to wear masks anymore. Indoor settings, the same. People are free to, as long as the establishment that you're going into doesn't have a rule that masks have to be on. So I think that's part of what's going to happen. Our restaurants going to feel comfortable saying people don't have to wear masks, but the CDC is giving them that option. So indoors and outdoors, if you're vaccinated, not in hospitals, not in nursing homes, not in areas where there are a lot of immunocompromised people, in your places of worship, you can imagine that at some point you may not feel comfortable with that at the moment, and I'm not saying you should have a masks off policy, but it would be reasonable even in that situation to eventually get to a masks off policy or
based on what Dr. Cinti talked about, I think the Islamic Center has made a decision that until at least a huge proportion of our community have been vaccinated, and that data is not available at this stage, we will still ask people that come to the center to wear masks and to go through the usual sanitization, hygiene, etc., etc. We are not changing the social distancing within the prayer halls or even within funerals and so on, that people have to keep their distances. And even people that come to my office, I still have the note in front of on my door that says no mask, no service. Because although I've been vaccinated, but I'm not sure what's going on outside. So to be safe, I think more than anything else, irrespective of what CDC says, the safety, for use of a better word, trumps everything else. So at this stage, we are not ready to move forward and say that you can take your masks off.
Thank you. Dr. Marks, you're on mute.
I think that sentiment is ubiquitous. A lot of the faith leaders that I represent or am in contact with have conducted their own internal surveys, and almost to a person, they are coming back pretty much 50-50. Half of the people enjoy virtual and want to continue in a virtual setting, irrespective of other factors, and half are anxious to get back into the sanctuary and they will likely follow the guidelines that Imam Kazerooni has outlined, where yes, okay, there will be in-person service, but will be socially distanced, will require masks, because there are so many immune compromised people in the church setting. I think we have to be particularly cautious about how we reopen, and we have really adjusted to this new world of virtual churching. It has worked. It has worked very well. The surveys that I saw found there was an uptick in participation. There was also an uptick in giving, and that has really caused a lot of faith leaders to go to a bifurcated system where they're going to be doing both. You will have the option of coming in, but if you go in, you're going to be likely wearing a mask throughout 2021 and probably into 2022 as well.
Okay, thank you. Bishop Jefferson, would you like to add anything to that?
Yes, that because and I was looking at the report from the CDC just then, because they said there are some areas that still have a high rate of people that are still being infected. And so when you see that, you have to use the precaution that it's better to mask up, better to continue to wash your hands, better to continue to protect yourself, because this virus is still airborne. And so if it's airborne, we want to protect everybody around us. I know I've had my vaccination, and I know others have, but I know there are those that have not. And 3 weeks ago, just 3 weeks ago, my niece was at work. A kid sneezed on her. She didn't know that the kid had COVID or was able to transmit the disease. She went to her parents' house. Her father, which is 80, that has been in the house the whole year, and mother, they got it. When she got home, her son got it. And so those were 4 people that had been protecting themselves, staying in. So if we don't continue to use the precautions, then it will continue to spread from those unknown. That's why they said that at first children couldn't get it and children couldn't spread it. But this was a child that spread it to her, and she spreaded it to other family members. And my brother said that I've been in the house the whole year, and here she come bringing it to me in the house. So it's still, you're still being able to carry it to your loved ones, and so we still have to use the precautions, because 70% has not received the vaccination. And so until that time, because there are some that cannot receive it because of compromised immune system, so we have to protect them as we protect ourselves.
That is very true. And I think you brought up something very important too. And it also is a question from one of our folks who's watching. When we talk about the misinformation and the anecdotes that come out that provide false information, the question is, what kind of tool can we build to help the communities rapidly fight misinformation and misleading anecdotes? So what is it that we can do to like really kind of jump on those things when they occur and catch them before they gain too much energy around the world? And then what are the most effective channels for real people? So just anyone in the community to get the right messages rapidly. So where are sources of information? And so Dr. Cinti, I'd like for you to weigh in on that first. Where are effective channels for real people?
Yeah, I'm a believer that within the communities, the folks here on this, all of us have a responsibility to our communities to go out and talk to them. And if we believe that vaccine is the right way to go, that we should propagate that message, and people are likely to listen to us within our communities. And just, great to hear that, again, Imam Kazerooni, you took a whole Friday, I think it was a Friday, you said that you spoke about the misinformation about the vaccines. And I think we have to keep doing that because it's going to continue to happen. The best, I do think the CDC is the best place to go. And as I think what we have to do is we as leaders in the community have to take the information from the CDC and then bring that to our constituencies, because we can't expect everybody just to go to the CDC. Even though it's the best place, it can sometimes be a little bit difficult to navigate through the different sites on the CDC. But it really is, it's the source of it. The CDC only publishes things and makes declarations or recommendations when they have the data. And so if you want to know what the latest data is showing, that's the place to go. World Health Organization is pretty good too, but I think in this country, in our communities, we really want to rely on the CDC. And I do. I mean, I check up and I'll read things on my own, but it's the CDC is a great place to go. And I don't know, all of you I know have gone there to look things up.
Well, while I have you, if I could ask you one more question, another medical question, and that came from our Spanish line. Can people from other countries get a less effective vaccine and weeks later, a more effective vaccine here in the United States? So basically, can people be double vaccinated?
Oh, that's a good question, actually. And what we're developing policies for that right now. So if somebody, what we say is at the university level, if a student comes in, say from China or one of the other countries and ends up getting a vaccine that's not approved either by the World Health Organization or the US, then we will recommend that they get an approved vaccine, and that would have to be one of the 3 that we have in this country. So there are there's a little difference between the WHO has approved all the ones we're using, and then there are a few others, and I won't go through all of them, but those can be used too. So that is a good question. Thank you for asking that. But they can get the other vaccine. Yeah.
Okay, so thank you. So Dr. Marks, what have you been doing to get valid information or corrected information out to the people that you see in your community?
Well, I think you're really asking 2 things. What am I doing to make sure I'm getting good information? And I would say working alongside scientific professionals, at Wayne State, Carmanos, people like Dr. Cinti who are doing this work and part of the various task force. They're writing and producing content on a regular basis so that we can have a reliable, uniform source. The health departments of the city of Detroit and the state of Michigan are also good and reliable sources. And then in terms of translating that information to the people, it's through deliberate interaction, like Imam Kazerooni said, devoting Bible studies and devoting services to a discussion about COVID-19 and how people are reacting to it. I mean, there's a burgeoning segment of case law that's going to come out of this. When you have a health concern, generally the health concern will override individual rights. When we talk about having a student be vaccinated with something approved by the United States, or having an individual go to work and be told that they have to have a vaccination, there are going to be challenges to those issues. So what we're trying to do in the faith setting is let people vent, let people get out their questions, and then encourage people to look at the science. Don't take my word for it. Don't take someone else's word for it. And if you want to know why I got vaccinated, because I trust the science and I relied on the science. And so I'll say that over and over again and just really encourage people. You don't have to become an expert, but I think as Dr. Cinti and I think Imam Kazerooni might have mentioned this as well, and Bishop, the CDC is a good source of information. It really is. And you can rely on the CDC, their statements. They're peer reviewed, they do trial. This is not just, willy-nilly coming up with something to fit the moment. This is what the Center for Disease Control does all the time, not just when there's a pandemic. So I think pushing people toward the reliability of that organizations and others like it is the best thing we can do to get people educated and caught up to speed about what's happening, what's real, and what's just so much fiction and conspiracy thinking that it's really frustrating when you have individuals who I can take a circle of 10 friends and every one of them has been touched by this in some way. You can't deny that this is very, very real. And that upsets me when people sort of go off the deep end and think this is some kind of hoax. It's just ridiculous.
Thank you for that. Imam Kazerooni or Bishop Jefferson, would you like to add anything to that?
Yes, Bishop, go ahead. Then I will add.
Because many of our facilities are closed, and that was the way we were able to be in contact with so many people. And I feel that it's our responsibility, not only as the religious sector, but as I am a community activist also. And so to get as much information that I can receive, valid information, and then begin to spread it. We have made up little packets to distribute in the community with their hand sanitizer, and then information on how to protect yourself and what the CDC is saying. And so we work hand in hand. I'm on a meeting most Fridays with the health department on the updates, what we should be doing and what we should be relaying to the people to give them information about the vaccination, give them information about those that cannot take it. So I continue to receive information and distribute information all over the community, not just to the religious community, because there are others in the community that will never set foot in none of the religious establishments. So we have to reach them also, but we have to reach them with information that will help them. And so I believe that it's to the pastors, to all, to get as much information as possible and then disseminate it wherever and to whoever we can, as often as we can.
Okay, thank you.
So
I want just to add something. I would like to go back to Dr. Mark's earlier comment that he said battle of information. I would probably craft it differently. I would say battle of misinformation, because what we are struggling with is not information, it's misinformation. And to be informed as a, say, religious scholar is something, but how to craft this information that would be suitable and beneficial to the community, it's a totally different thing. If I were to ask the community to go to CDC website or anywhere else, they are not going to go. They simply would ignore it. So what we had to do in collaboration with a number of organizations that are active social services within our community, such as Access and others, we organized a number of town hall meetings that invited people at the center and other places, invited people to come in, where expert would come in and provide information to the community. Workshops that I had organized by myself by collecting information and turning it into kind of screens and providing it. But as Bishop Jefferson said, I think what we really needed to do, and we still are doing it, is the constant bombardment of the society with the fact that this is serious. Look, during the past week, we have lost 1, 2, 3, 4, 5, and we mentioned their names, our friends within the week out of this COVID-19. Take it seriously. This issue does not recognize young people or old people, male or female. So by constantly at the pulpit and other places and organizing workshop and even printed material, sending it to the social media and Facebook and other places within the website so that the community has access to it. I mean, these are the only way that we can deal with it. I have organized classes and lectures on Zoom and Blue Jean and that specifically deals with these issues, but we still have resistance within the community. Unfortunately, the misinformation that early or the conspiracy theory created so much doubt in the validity of science that now we really have to start our work all over again. And we have started our work by providing correct information.
Yes, yes. I want to be mindful and respectful of the time and give each of you an opportunity to have final remarks as our time grows close to 7 o'clock. But I think there's been some very important things that were said this evening. One is that we need to be well informed. We need to educate ourselves, and there are trusted places to go. The local health department, the CDC. I believe for me, in my family, I'm that trusted person. So I've had my mother who will call me and say, I talked to sister so-and-so and she said this. And I said, okay, Mom, that's not exactly true. And I will give her the right information. So then what she will do is she will hang up the phone. And then she will call sister so-and-so. Then sister so-and-so will call somebody and call somebody and call somebody. We're using that oral tradition that has always been, I think, part of the culture of people of color, of communicating and talking. And so it's important that we keep that oral tradition going and talking to people so they recognize what is true information and what is misinformation, because that's the only way that we're going to return to some type of new normal. And so I would like to offer everyone 2 minutes to close. Any final remarks, anything that you like to say, encourage people to get vaccinated. This is your time. So Imam Kazerooni, since you're on my screen, I'm going to start with you.
Thank you, Alfreda. Well, I want to wrap up at least my part with 2 comments. Number one, by thanking the organizers for organizing such webinars, because to deal with this, it's a community issue. It's not just one center or one type of organization. It's within our community. I made it clear from the beginning that we need the physician, the pharmacists, the nurses, the police, and the scholars and everybody else to work together. So it's a community issue, and I believe everyone has to work together and share it. And number 2, if we want really to expect our community to make critical decision, they have to be well informed. And that in providing information to the community is pivotal, and without it, they will not be able to do it. So they will be lost. So it's the responsibility of all of us to get, as the bishop said, to get the right information disseminated and provided to everybody else. Hopefully we will succeed.
Thank you. Bishop Jefferson?
Thank you. Thank you for the organizers that organized this. Truly, it emphasizes that we need to learn and be able to help. And what I think about in our community, that trust is earned. And so they look to those that they can trust, that would tell them the truth. And one thing that I know that when you give them the right information.
Oh, I think that we have lost Bishop Jefferson. We have lost Bishop Jefferson. Bishop Jefferson, we're having technical difficulties with you. So I'm going to move on to Dr. Marks. And if she comes back on, we will continue.
Sure, and I'll be brief. I think it's important that we, as everyone is saying, get information out, there are some reliable sources. The CDC is one of them. Make sure that you're getting the information and, as everyone has said, disseminating it. And then let's also be mindful of the tremendous health disparities that exist. We have to do a better job of making sure communities of color, communities that are traditionally not in the best economic shape, we have to do a better job of making sure that they get access to primary care physicians, that they're utilizing that access, and that it should be a no-brainer. We have to do better. And if nothing else, this pandemic has certainly pointed that out. There are curable diseases, pre-existing conditions that people have that are curable. And the fact that they're not interfacing with a physician on a regular basis because they don't have adequate health care is a problem. We have to do better. And I'm hoping and prayerful that we will. And thank you all for organizing this. This has been fantastic.
Thank you. And Dr. Cinti.
Yeah, I want to echo everybody's thanks to the organizers. This is just great. And I just realized I do way too many talks in-house. These are really the useful ones. I think I end up preaching to the choir when I talk. You know, I give talks to our residents and our faculty, and really each one of those people should be going out and doing what I'm doing here. And I would like to do more of this. And so every time I've participated in these events, it's always been an eye-opener for me. So thank you, and see you all at the next one.
Okay. So
God
there,
willing.
inshallah. Yes. So I just wanted to do a shameless plug, because we were talking about side effects, about infertility, allergies, and its effects. And on June 5th, Community Health Services is doing a town hall that will be answering those questions, specifically about that. It's from 10 to 11:30 a.m. on June 5th. And we will be sending out information about it. I also want to ask you to save the date for the 6th and 7th in this series. Our next webinar will be on Tuesday, June 29th, and then Tuesday, July 27th, both of them being at 6 p.m. We want to just tell you, thank you so very much for joining us today. We hope that you have heard something today that has increased your knowledge, but we don't want you to just hold on to that knowledge. We want you to share what you have heard with folks, because that's the only way that we will continue to move in a positive direction, is by making sure that people are getting out there, that people are getting information, and that people are being encouraged to get vaccinated if safe for them to do so. And so on that note, I want to say thank you again to our panelists. Thank you to Michigan CEAL, Dr. Erica Marsh, and Ms. Perkowski for inviting me to be your moderator. It has been a pleasure. Thank you so very much.
Thank you. Thanks very much.
Thank you.